I am Dr. Jennifer Tanner, the founder of Run Lab, the Summit for Runners' Health and Performance. So if you've ever seen those hit, stop, sit ads that are out right now, you really need to pay attention to this next guest. Melissa, we have her on here. She's going to be talking about concussions, and concussions have been getting a lot of media lately, as they should, but there's a lot of confusion around it too. Like, what do we do? It seems like there isn't a lot that we can do, and Melissa's going to break that myth. So we're really going to want to pay attention to what she's saying. We're really going to listen up, because especially people who have kids, and you might think, running's not really an impact or a contact sport, so concussions are not necessarily something we have to watch out for. But you would be surprised how many patients I have in the office, and I actually have one right now who was running, slipped and fell, and now has a major concussion and cannot work. So it can happen to you as well. And so Melissa's going to help you be prepared and know what to do. So today we've got the fabulous Melissa Biscardi on. She is a woman of many things. She is a registered nurse. She is an osteopathic therapist, and she is a concussion specialist. This is why we have her on today. She has published numerous articles on brain health. She's working on her PhD. She just loves school. And she has a private practice here in Toronto called the Rehab Lab. So welcome, Melissa.
Thank you so much. I'm super excited to be here and talk about concussions, but also I'm an avid runner. I love running. I've been running since I was a teenager, and it's kind of my moving meditation. So I can totally relate to the people who are going to be watching this and love running and not wanting to interfere with the running practice.
Beautiful. So, yep, that's what we want to hear.
Right?
Yeah, because that's one thing runners don't want to do. They don't want to stop. So
exactly.
So tell us, like, the basics. Like, what is a concussion?
Sure. So I do always like to start off talking a little bit about this, because there are some misconceptions. And one of them is that you actually have to get hit in the head to sustain a concussion. That is not true. So certainly if you get hit in the head, you're concussed, but you can actually get a concussion from the jarring motion. So I have a patient right now who was running, slipped and fell, did not hit her head.
Situation.
Right?
See, guys, especially those Canadian runners out there in the slick ice. This can happen.
Right? Exactly. And she didn't hit her head, but it's actually that jarring motion. And pull out my brain model.
Oh yeah, let's
see
it.
Brain here, right? And and this guy's hard, but our brain is more like jelly. And the concussion happens because that jelly shakes around in the head. So the whiplash motion, think of like car accidents, these can cause concussions as well. Or a hit in the head. So both of those can cause a concussion. And another sort of misconception is that they happen always in sports, football, but more can happen in the general population, from slipping and falling, getting up fast, hitting your head on the cupboard. So sort of those everyday things where we're not really paying attention, and then we injure ourselves.
Yes. Okay. Yeah. I think definitely, it seems like a lot of those really hard injuries are where like people aren't really paying attention. They don't have a chance to brace themselves, that kind of thing. If you know a hit's coming,
exactly,
you can prepare yourself for it. So what are some of the myths that you see when people come into your office, or you see stuff on the media? What are some of the myths about concussions?
Yeah. So one big myth that myself and other practitioners are really trying to break is that rest. So we did believe that for many years, and now we know better. Like a concussion is a rehabilitative injury. So just like if you sprain your ankle, you don't want to like wrap it up for 6 weeks and just leave it there. You want to rehab it. And the thing is with the brain, we actually want to do active rehab. And sometimes I'll just be out and about and hear people talking about their concussion and saying, oh, well, there's nothing you can do for it. And
that must drive me wild. There's not much you can do.
Exactly. And
Okay.
actually, early intervention, so same with a body injury, early is better. You actually don't want to wait.
Okay.
And waiting time can actually prolong your recovery. So you think you're best, you actually want to go in and take action right away and start making the steps to recovery, sometimes as early as 24 hours. It'll depend, like a concussion is a sort of wide spectrum, but yeah, early intervention is best. And also an old myth was, oh, you got to wake up every hour, don't let the person sleep, but that is no longer best practice.
Okay.
You know, there are certainly flags, but generally go to bed at your regular time, wake up at your time, like trying to keep that rhythm of your life.
Okay. Okay. So yeah, so don't interrupt the person
Yeah,
if they're
exactly.
actually
They're
sleeping
just gonna get really
and
angry at you.
and you're recovering. All right. So just say, okay, so was out running, I slipped and fell. I'm pretty sure I have a concussion.
Mhm.
Now what do I do?
Yeah, absolutely. So it's really interesting because some of the things are the things you'd be doing anyway. So you want to be avoiding really sugary, inflammatory foods. Like fill
Mm-hmm.
yourself with some, you want to eat something healthy, some vegetables, some chicken, nothing that's going to just inflame you even more.
Yeah.
No alcohol for sure, and no medications that might cause like drowsiness or anything like that, because you want to be able to tell what you're feeling from the concussion.
Okay.
You definitely want to avoid screens. And
Mm.
the reason is because the screen is actually a strobe light, right? It's actually flashing right into your
Yeah.
brain. It's just way too much stimulus. So certainly put the dimmers on your screens. If you have the blue light filtered glasses, even better.
Mm.
Just try and avoid the screens.
Yeah.
Take it easy, but you want to be up and walking around, getting the blood flowing. Those are the main things. And then, of
Okay.
course, get checked out.
Yeah.
That there are a few red flags you want to watch out for. If your
Okay.
pupils are two sizes, any
Yeah.
tremors, like things that would be alarming,
Yes.
regardless if they happen to
Okay.
you, then you definitely want to go to the emergency.
Okay. Yeah. Are there any tests for concussions?
So, concussion diagnosis is usually based on a history. So, fall, did they see start time? There's actually a really wide range for diagnosis. So, you could lose consciousness. You could not lose consciousness. You could lose consciousness for 20 minutes. You could have amnesia. You could not, like, it's
Yeah.
just crazy, the,
Okay.
the spectrum for a concussion diagnosis. But then the tests that we will do are like a neurological test. So testing the eye movements, testing the reflexes, the sensory system, and okay, what's going on with the brain now?
Okay.
So,
Okay.
so there are some tests that can be done.
Okay. And are there differences between men and women when we react to a concussion the same way?
So there are, and especially because of our hormones. One interesting thing, I just read this article 2 days ago, is that women are actually seeking care later. And this is
Oh.
not great because, as I just told you,
Mm-hmm.
it's seek care early.
Okay.
So they're seeking care later, and this is affecting their outcome. Women typically have worse outcomes over time.
Okay.
And so this is actually just a new piece of information I've learned, that maybe one factor is getting in fast enough into
Mm-hmm.
the rehab process. But another factor is definitely our hormones, and our periods can really be thrown for a loop.
Mm-hmm.
And some women will actually miss their periods, get an extra period. And then there's just all of that stuff along with menstruation, right? Our emotions are going to be
Mm.
off.
Okay.
Yeah, and women typically have a stronger history of migraines, and concussions are sort of a migraine. So we always get the short end of the stick, I feel like. And it's right. Now, for men, there can be hormone disruption as well, and it will just manifest a little bit differently. So more fatigue, ability, and stuff like that. Libido as well. But they
Yeah.
don't sort of have the menstruation to be like, crap, something is off.
Mm-hmm. Yeah. Okay. Now, let me see. So what we're looking for, just to recap, like those symptoms, we're looking for the pupil discrepancies, we're looking for irregular periods, we're looking for changes in mood, we're looking for headaches, emotional shifts.
Yes.
Is there anything else that we're missing? I mean, there's probably 100 things on your list that
So definitely a lot of people will have nausea or dizziness, a sense of disequilibrium, also maybe some blurred vision, headache. Migraines are huge. Most people will get those. Just not feeling like yourself. Often people will come in and just say, I just don't feel like myself. I'm a little slower or sluggish, light sensitivity, sound sensitivity. Those are
okay. So the big question. So if you guys are wondering, you're like, oh, I'm concussed, and now what? Melissa has actually put together a file for us that you can access at the end of the video. It's called Concussed Now What, with some processes for you to look into if you're just not sure, right? Because it's a bit of a new field out there in regards to what do we do, right? We're still kind of developing those pathways. People like Melissa have devoted their life to that now, right? So any research coming in, Melissa is the one to go for that. But the big question is, okay, can I run after I have got a concussion?
Okay, so I'm so happy to talk about this. So it's very interesting because the best practice after a concussion is actually early activity. So I'm not going to say go out and run the next day, but the next day I do to start with a walk at conversation pace. And anytime starting an activity up again, you are going to pay attention to your symptoms. So let's say the concussion happens Friday, Saturday, Sunday, you're going to go for a brisk walk. See what kind of pace you can do, monitor your symptoms. If you can only do 10 minutes and then you start to feel crappy, the next day you're only going to do 10 minutes. It's called, so you would appreciate this sort of sub-symptom mold. You're really your symptoms as a monitor of what you can do. Now, if you're okay with squawk, then for a few days in a row, then you can increase it a bit. The thing is, if you have a concussion and you try and run, you're going to feel like it.
Yeah, because running's an impact sport, right? So you're having that continuous jarring that's ricocheting up to your brain, I would imagine. It is kind of feeling the vibrations and what is happening further down. So my initial instinct would be like, no, you cannot run after you are. But I guess from what you're saying, it depends on the severity, and you do want to move. So you want to get it.
You want to move, exactly.
So things like that, like you mentioned, you want to be an active participant in your care. So is that an example of what somebody might be doing with yourself when they're seeing you for the concussions? They're doing some of those lifestyle modifications. They're implementing some maybe gradual exercise or movement or whatnot. Are there other in clinic maneuvers that you're doing with clients?
Yeah, so definitely there's a similar protocol, but yes, activity, like I just mentioned, and there are diet recommendations, and there will always be some sort of therapy, because anytime you get a concussion, there's a component of whiplash to it. So we want to be clearing that out, getting the blood flow in and out, trying to clear that inflammation. And then depending on the person and how they present, there will usually be some eye movement or other things. In a concussion, almost 100% of the time, there's some in the eye movements or eye stability. So we want to correct that. Yeah, and a lot of the symptoms will be because of that.
Okay. Yeah, okay. So again, to recap, ladies, ladies, are you listening? You need to get attention first. Very interesting from that concept, because I feel like from healthcare, women tend to reach out sooner for other issues, but I guess from a concussion perspective, you know, like there's a lot of stuff going on. You got kids, you got work, you got stuff that you're trying to get done that you're probably thinking, I feel fine, I can do this kind of thing. But you can do it better.
And maybe
if
we
you have the
attribute
help
it
of
to
a
something
professional.
else too, or just
we might attribute it to something else. There's so many things that contribute to how we are feeling. But you know, rest is important, but it's not the only option, right? It's not just rest is best, it's active rest.
Right,
sounds like. Yeah. So you are an active participant in your care. Your care is going to be a combination of you being involved, of some manual therapy, of modifying those things that are creating inflammation. Disease loves inflammation. If you want to recover faster, we got to modify some of those inputs. So Melissa mentioned the sugar, do a kick sugar, which probably be doing anyways.
Exactly.
And alcohol is a big culprit. And don't mask your symptoms with non-necessary medications. Obviously, if they're life-sustaining medications, don't mess with them. But if there's something that you're just taking that might cause you to be a little bit more drowsy, and mask those symptoms. And avoid the screens. That's a huge one. It's such a huge neurological stimulus. Like we feel relaxed.
Exactly.
Our body is kind of, you know, we're laying down or whatever, but your brain is not relaxed at all. Like
it's true.
Up at night,
it's like on fire.
It puts us into this like sympathetic dominant state where our nerves are on like high alert. And I can only imagine what it is doing to your poor little brain when it is recovering from this like ricochet that it just had to experience. So again, Melissa's provided us with that Concussed Now What document. Check it out. At the end of the video, you'll be prompted. It'll show you where to go. But Melissa, if somebody's concussed, they're not really sure, they don't know where to go or what to do, how can they get a hold of you?
Sure. So my website is rehablab.ca. There's a button to contact. It will come straight to me. And even so, of course, I'm happy to help one, but if you're not in my area, I have a great network also. So my main thing is I want people to have appropriate effective. So please reach out. I'm always love to talk about concussions.
Oh, that's beautiful. Did you hear that, guys? Like Melissa and I were both based in Toronto, but if you are not in Toronto, she has a wonderful network that she can refer you out to, and probably like guide some of those questions as well. So that was it rehablab.ca? Yeah.
Yes.
Okay, rehablab.ca is where you can reach out to Melissa. Head over to her Concussed Now What document if you want forever viewing of Melissa. You can link onto that as well. So it was great having you on today. Thank you so much.
Thank you.
And we will talk
so fun.
Okay.
Thank you. Bye.